Hi everyone. Welcome to RSB Healthcare Consulting. 5 medical billing tips for your healthcare practice. 1. File claims daily. Getting payers to reimburse you in full is challenging enough. Don't let timely filing ever be a reason for a denied health insurance claim. If your staff only dedicates 1 to 3 days of the week to filing claims, they can pile up much more quickly than you realize. Never let a stack of charges turn into a payment issue. Make it a priority for your back office always to file daily to improve your clean claims ratio. Collect copays at time of service. As a billing company with 20 years of experience, people, we've said it before, any unpaid balances hurt your revenue. Those $15 or $30 patient copays may not be top of mind when you think about your reimbursements, but they're just as critical to your balance sheet as any other payments owed. Determine in advance what copay each patient owes you at the time of service and make it an office policy to collect in advance. Have your front desk staff escalate any issues with patients who regularly refuse to pay up. 3. Update and verify patient insurance. We understand that patients, especially frequent visitors to your office, hate to dig up and hand over their insurance cards every time they come in. But making sure that there are no changes to a patient's insurance is the only way to make sure that you handle things appropriately with their insurer. While conducting eligibility checks may be becoming passé in some specialties, we're firm believers in verifying each patient's coverage in advance of the encounter. It only takes a few minutes to verify insurance, but unpaid claims down the road could take you months to collect. 4. Track and follow up on unpaid claims. Are you keeping track of submitted claims and tracking how long it takes for them to be paid? You can't just sit back and expect timely, accurate payments to come into your office regularly. Knowing what you're not being paid for is just as important as knowing what you're being paid. If a claim takes longer than 60 days to be paid, follow up before you resubmit. Sometimes all it takes to get your claim handled by a payer is a phone call. 5. Make friends with EOBs. Scrutinizing all explanation of benefits, EOB, forms can be a smart way to spot unnecessary payer downcoding, bundling, or denials. Assign a staff member to compare EOBs to payments, and don't let any of the forms slip through the cracks. You may also want to consider working with a medical billing company that has the bandwidth to pay close attention to EOBs and the expertise to follow up appropriately with the payer. Getting paid correctly may require persistent follow-ups. Outsourcing to a medical billing service can take the time and effort of the task off your office's hands. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.